Welcome to Age-Friendly Edmonton's Lunch and Learn entitled Gray Hair Blues, Reshaping Negative Thoughts About Aging. One of the definitions of ageism is the systemic stereotyping and discrimination against people because they are old. Ageism is present today, and it puts unfair challenges on older adults' abilities to live their life to the fullest. This presentation today is from Dr. Donna Wilson, and she will be focusing on ageism in healthcare. Thank you for being with us today and joining this presentation via Zoom. My name is Kathy Harvey, and I'm the co-chair of the Age-Friendly Edmonton Ageism Hub. This event is brought to you by Age-Friendly Edmonton, a collaboration between the Edmonton Seniors Coordinating Council and the City of Edmonton. Age-Friendly Edmonton is part of a global movement to build age-friendly cities and communities. Edmonton is a city that recognizes the diverse populations and needs of seniors and actively supports their inclusion, engagement, and well-being. Now we would want to honor those who came before us. We have this opportunity to learn and share knowledge together. We acknowledge the traditional land on which Edmonton sits, the territory and the Treaty 6, First Nations, and the homelands of the Métis people. We would like to acknowledge and thank the diverse Indigenous people whose ancestors have occupied this territory for centuries. Together, we call upon our collective honored traditions to work in building this great city of Edmonton for today and for the future generations. Now it's my great pleasure to introduce our speaker today, Dr. Donna Wilson. Today she will speak on ageism in healthcare. She is a full professor in the Faculty of Nursing at the University of Alberta. Her research focuses on health services and health policy as it relates to aging, ageism, and end-of-life care. Dr. Wilson's work is oriented to myth-busting to ensure effective and accessible healthcare services for older people. Her investigations often involve population data and mixed methods research. Dr. Wilson is frequently consulted for expert commentary on aging, end-of-life care, health policy, healthcare services, and health system trends and issues. Now, over to you, Donna.
Thank you. As you can see, I was monkeying around with my presentation. So sorry if that was distracting. Thank you very much for the introduction. I'm really looking forward to talking about this, and great topic. Wonderful that the Edmonton Seniors Coordinating Council identified this, age-friendly Edmonton. This is a terrific topic. And I suspect that it's quite a major issue now, and it could certainly get worse. So wonderful timing. Now I'm going to move really quickly through this. This PowerPoint, I'm happy to send it out to anyone. And I'm sure that the organizers of this presentation will be happy to share it as well, too. So what I'm going to do then is just jump right in and just mention really that population aging is not something new. And so ageism is not something new. In fact, if you go back into the records, the early media, the newspapers, whatever, it was actually the last pandemic 100 years ago where people started realizing, oh my goodness, young people were dying. And it was World War I was on too. A lot of young people were dying. And they said, my goodness, we've got population aging. Oh, and that was the first time it started to be seen as kind of a doom and gloom sort of thing. But of course, we now know and more often recognize population aging because aging is accelerating. And it was actually the previous census, the Canadian census, that really pointed that out. And it was a big headlines I remember in the media a lot about that there were more people now in Canada aged 65 and over than children under the age of 15. And that was just major news. And in fact, they estimated by 2030 that the baby boomers, and I'm a baby boomer, many on today probably are, when all of the baby boomers are 65 plus, there was 10 million of us starting out. Somewhere between 25 and 30% of Canadians will be older. Now, the most recent census, last year's census, found it was 19%. So, so again, we're not there yet. Many countries around the world have had 25% or more for quite a number of years. So actually, we're quite a young country in many ways. So it's obvious that population aging is happening here and pretty well everywhere else. But what is not obvious is what we're going to do about ageism. And I'm going to just briefly focus on two aspects of aging, and that is our own personal thoughts about getting older. A lot of people do fear becoming ill, dependent on others, lose our looks, etc., all that kind of thing. But then there's the larger general societal and certainly government, the negative reactions to a greater proportion of people being older, or even the frail elderly. I'll get into that. But also it's coupled that with that there's many more people actually that are going to be very old or old. And healthcare ageism is a particularly common and very highly problematic and also overlooked issue. So I'm going, in terms of objectives, I'm going to, hit some of the topics just to make sure that we're all sort of thinking about ageism in the same way. And I'm going to talk about three types of ageism in healthcare. And probably what a lot of us experienced, the minute you kind of get gray hair, which for many people starts at about age 45 onward, and certainly older on, is minimal or no care being offered, and also expected by the person and their family too. They think, well, I'm old, it won't benefit me, or I just won't even get it. I won't even ask for it. But another major issue is inappropriate care, and I'm going to get into some of that. And I will touch on older worker discrimination as well too. And certainly I'm going to answer the question about what can we do, each one of us and as groups, about old age stigma and the two types of ageism. So again, sorry if I'm running through this fairly fast, but I'm going to ask you three questions. And by the way, I ask my nursing students this because we're concerned about whether nursing students get a positive view of aging and old people. And so the first question is, how many of you think that you will live to be 100 or even older, or close to that? And, so just kind of give that a little thought. Well, actually, if you are part of the baby boom generation, which is a very unique 20-year cohort, and long after World War II, the group that had the best education of any previous generation, the best income, the best food, the best safety and security, we haven't had a world war. The best health care as well too, which included vaccines and antibiotics and ICUs and everything else. Many more of us will live to be 100 years of age or close to it. And probably the best guesstimate is around 10%, whereas it's about 1% now, maybe not even 1%. But it is possible with all these scientific developments and other developments that most people in developed countries could live to be 100 or even perhaps 120. Which is seen as kind of the absolute boundary for human lifespan. But here's the flip side. It's also possible with climate change, certainly with this pandemic, widespread obesity in both children and adults, and that's not just food choices, but also inactivity, and other issues for a reduction in life expectancy to occur. And in fact, that's the fear now, that in fact, we will live less long in future years. And we're pretty good in Canada in that our life expectancy is well, if you're born in 2019, just before the pandemic started, be 80 for males and 84 for females. So we do know women tend to typically live longer. Now, Stats Canada is really good for having these wonderful population pyramids. And if you can see across the blue line, that was what the population of Canada looked like in July 1st, 20 years ago, well, 22 years ago, 2000. And you can see that the most people, if you looked at a mode, would be around age 40. That's that huge population boom of the baby boomers. There they are. And of course, now the baby boomers are 20 years older. And so you see this bump up at the top, followed by the echo and then the big millennial generation that still in some ways is smaller than the baby boomers. But again, the big concern is that great big group of people is going to all hit age 65 when of course they'll all be sick and in hospital, and shortly after that in a nursing home. That's the common perceptions of aging that governments have and that a lot of families have as well. So, okay, now come on. Okay, second question. How many of you want to live to be 100 or more years of age? And this is really where we get into exploring ageism. So give some thought to it. Do you really want to be 100 years of age and over? I'm not so even sure myself. Because, what's come to mind when you think about old age and old people, and even what images kind of come to mind? So do these images come to your mind? I'll just take a sec to look at these 4 pictures. I really searched around and found what I thought were probably pretty common pictures. And in fact, these are known as the 4 Ds of old age: dementia, depression, disability, and death. And this again is what governments tend to think about old age. Family members tend to think about this. Even people, once they start to think about their own aging, these are the fears typically that we have. The issue, though, is these are much more accurate images of older people in Canada today. Traveling, exercising, enjoying not working or enjoying days off, maybe enjoying dating. This could be the second husband, who knows? Working and having fun at work. And of course, having fun with grandkids or children in the neighborhood or what have you, and being really meaningful mentors to younger people. These actually are much more accurate images of older people today, but they don't often come to mind. And really, some of our earliest images about aging come from our grandparents and people when we were young. So I was lucky. I had a vibrant grandmother who I could barely keep up with, and she was happy and fun and constantly learning. And I realized I gained a very good perception of aging. And thankfully, that happened before I became a nurse and started looking after people in hospital where, many nurses and doctors only come into contact with older people really when they begin to look after ill older people. And so that is what image comes to their mind. Now, the reality is that more and more people are living to be 80. That's a young elder now. 85, 90, 95, and even 100. There's 1,000 people in Canada now that are 100 years of age or over. You only get to be that age because you typically have been healthy all of your life. You're active, productive. You have enough income to live comfortably. You've got friends and family for fun and for support at the times you need it. You have some pretty healthy living habits and you avoid some hazards, like falling in winter and stuff like that. So now, yes, of course, nursing homes are full of people who are usually age 85 and over, But the reality is only 3 to 4% of older people actually spend their last days in a nursing home. And it's pretty easy to figure that out for Alberta or any province or even Canada as a whole. In Alberta, there's 14,000 nursing home beds, and that is 3% of older people in Alberta. You can get the figures from Stats Canada. And of course, then, not everybody stays for a whole year in a nursing home, so you can bump it up to 4%, and that's probably generous. So again, we start to think about some of the myths that we have about getting old. I want to also blow out another myth, and that is, well, of course, hospitals are full of old people. Well, actually, in Canada, thankfully, we have CIHI, which has access to hospital data, and I'm purchasing some hospital data soon from them to really look at, what older people are in hospital and what have you. But actually, only 8% of all Canadians, regardless of age, are admitted to an acute care hospital each year. And those hospital stays are 7 days on average. They make a big deal out of the fact, though, that older people typically have longer hospital stays. I'm going to touch on that later on. But I want to point out the top 5 reasons why people go into a hospital today. Only 8%, remember. Number 1, giving birth. Now, I do not know of many 80-year-olds who are in hospital giving birth. You know, I'm seeing a few smiles. We might be visiting our grandkids or whatever, but we're not the ones giving birth. The second most common reason why somebody goes into hospital is a lung problem, COPD. That and bronchitis, that starts at about age 35. People who are born with asthma, heavy smokers, people who've had lung damage, or you were born with, problems with your lungs. And so that starts at about age 35. Heart failure, now that's probably the one category where it's typically people 65 and over. And in fact, it's commonly people in their 80s, so there's maybe where we can say hospitals are used by older people. Heart attacks, the prime time, and sorry, men, if you're watching, this is in the 50s. When you're in your 50s, that's when you're at risk of this. And the 60s as well, too. That's the prime age where people come in with a heart attack. Osteoarthritis of the knee, where you're going in for a knee replacement. Again, 50s and 60s, and then of course, then 70s and 80s and up as well. So when you look at the most common reasons why people are in hospital, it's not old age concerns or concerns that are confined to older people. Now, here's the third question I'm going to ask all of you is how many of you experienced healthcare aging? And that's the 3 kinds. Minimal or no care was offered to you, or you just went in there and kind of thought, well, there's probably nothing that can be done about this, and I won't get anything. And maybe your family as well. Inappropriate care or older worker discrimination. So we'll get into some of that, but I'm really keen, and I've had family members that have had older person discrimination in a healthcare setting. Now, I just going to mention ageism is the most common and overlooked form of prejudice today. I mean, we've made great strides about gender equity and racial equity, and we have much more concern about our Indigenous people and the residential schools and what have you. But we tolerate and even accept old age discrimination. And it's no surprising then, it's just so ingrained. Most people are afraid that as they age, they will become ill. I'll be sick. The day I turn 65, I'll be sick. I'll be disabled. I'll be dependent on other people. Of course, I'll be senile. I'll be confused. I'll be powerless without influence. I'll be victimized. Somebody will be out for my money, my etc. and poor. And these fears are justified in some cases, but those tend to be the individual sad cases. And yet we think that that small proportion of, cases is like the norm. people and groups, including governments, without thinking or knowing the evidence, will sometimes deliberately or just, without even thinking about it, sort of live with these myths about age. And again, just to emphasize, ageism is the most common and overlooked, if not the most widely accepted form of discrimination today. Now, why do we age? So it's our cells age, they become damaged kind of over time. But it's clear, though, that it isn't just sort of a step one, step two, step three, step four, kind of a linear, first it starts, then it, more and more and more and more. And really, we know now that cell damage and cell loss is really very loosely associated with someone age in years. We have people in hospitals now that are 25 that have older cells and more cellular damage than 95-year-olds. And some of that, of course, is lifestyle and what we put into our bodies and the rest, but there's other factors. We also know that aging isn't just our cells aging and or losing cells, but in fact, it has a lot to do with major events in life like retirement, relocating, the death of friends and partners. So there's certainly a lot of factors that go into aging, and there is no such thing then as a typical older person. So if you think about aging, as we age, we become more diverse. So we're all, when we're in the womb, we're all fed by a placenta. We're all born, and you think of babies, really very simple needs. They need to be fed, they need a dry diaper, they need to be stimulated. And then as you start going to school and go through your life, some go to university, some don't, some, get into really good income jobs, some don't. Some marry and have lots of kids, some don't, some lose a spouse, some don't. We become more and more diverse as we go through life. And so treating all older people the same is a major form of discrimination because it doesn't look at us as individuals. So again, we look at biological aging. So we've got the cellular, lack of division, growth, and repair. But that really gets into something that I've got to mention very briefly about frail elderly. If there's anybody going to be discriminated against now in Canada and most other countries, it's the frail elderly. And we tend to think of people 85 and over, they're all frail elderly. No way, shape and form is that correct. Actually, the researchers on frail elderly have pointed out that you have to have 3 or more of the following criteria. You have to have weight loss. You didn't intend to lose weight, but you have lost weight. Self-reported exhaustion, weakness, slow walking speed, and low physical activity. Those, actually, you have to have 3 of those to actually be diagnosed as a frail elderly person. And the first researchers that started looking at that and since have found less than 10% of older people are the frail elderly. You can be 90 years old and you are not frail elderly. But again, everybody thinks that at age 85 and onward, so you were good from 65 to 85, but oh boy, once you hit 85, you're going to be the frail elderly. And that there's nothing correct about that. Here's the oldest woman, by the way, 119 years old, and enjoys visits from grandkids and great grandkids and what have you. But anyway, she kind of exhibits sort of what we kind of assume what a frail elderly person would look like just by appearance. Now you can imagine, again, appearance goes a long way to how people see you, including your doctors and nurses, and then how they may treat you. Now, back a few years ago, this was a commonly used chart in government circles, which is, getting into that, oh my goodness, we have population aging, let's all be afraid. because our hospitals will be full, we'll be bankrupted, everybody will be getting the Canada pension, etc. And the big fear was, look at the people 85 and above, because of course they're all going to be frail. They all need to go into a nursing home. It'll be the revolving door in and out of hospital are frail elderly. And again, the projections are that more and more of us will get to be into that age range where we're really a drain on society. That's the common perception. And again, a lot of myths. And again, it misses out on the diversity amongst older people. Now, let's talk about the evidence. So certainly there is evidence of older worker discrimination. I think about nurses that at age 55 and on are really encouraged and expected to retire. Well, you know, you won't be able to work night shifts anymore. You won't be able to lift anymore, of course. And, you know, of course, most women, you know, most nurses are females. Well, they're encouraged to retire because, well, you know, your husband is probably retiring. And so you should, you know, spend some time, you know, with him. But really, there's very clear evidence that older people are not hired in the hospitals and everywhere else if a younger person is available. And we have no laws or regulations against those using age as a criteria. Older people are often not promoted. They're not retrained. They're not rehired if there's a layoff. They're not helped at work if they do have a disability. They're not offered a leave to take time off and then come back, you know, because maybe they have a sick spouse or whatever. They're not offered a phased in or partial retirement plan. So we know that that's one of the concerns, and healthcare loses out a lot. When you've got very few nurses still working at age 55 and older, and respiratory techs and etc., you know, all kinds of people that took years to develop a lot of knowledge and skills, you're losing out on a lot of really important, knowledgeable people when they retire, and they're gone from the workforce. And of course, then we're, you know, trying to, you know, bring on young people, train our own people, or bring them in from other countries. We just kind of think, well, they'll just jump into the workforce and they'll be good from the first day onward. It takes years to become really a skilled healthcare worker. Now, along that line too, it's often thought that older people do not work. And some of it is because, well, of course, they're sick and, you know, they can't work. But of course, we also know, you know, it's like an old dog can't learn new tricks. Well, older people can't learn or adapt to change. And in fact, what we're seeing in Canada now is in every 5 years that they do this measurement, the average and the median age of retirement is going up. And that's particularly true for people who are hired, but also self-employed people who typically retire late in life. If you think that the current median age, if you have your own business, is 66.6, roughly 67, well, that means that half of them are working later than that. So we have people 80 and 85 that are running successful small and large businesses. And when you think about it, many people work longer in life now because they enjoy their work and they're good at it. They start a career late in life. They start a business late in life. And a lot of us need to work to pay for that new home, to support children through university. And you're healthy and you're able to work and you're asked to keep working as well too. That's the working group for pay, but also think about many volunteer care for ill family members and everywhere. And older people pay taxes. People forget about that as well too. Now, the second big aspect about healthcare ageism is evidence of minimal or denied healthcare. I spend a lot of time going through and looking at the studies and so what research in Canada, the US, and other countries show. And it's pretty clear that physicians, and sometimes nurse practitioners and pharmacists and others, do not offer healthcare to people that they think will not benefit from it. So that's kind of ethical. You can say, well, that's really good. You know, you shouldn't have something pushed on you if it's not going to help you. It's just a waste of healthcare dollars, a waste of time. Why have a test if you don't really need it? And all the rest. It could be a painful test or treatment or whatever. It's not going to work. Why have it? But the issue is that if that healthcare provider, that physician or whoever it is, has ageist views, older age will be just used as a simple criteria for denying care. And of course, in Canada, we sort of, everybody has a right to health care here. And so doctors then are almost have a responsibility to make sure that they identify people who won't benefit for it. And, you know, then we've got full hospitals. So why would you put someone in there that won't benefit from this treatment? So they have an ethical responsibility, especially in Canada here, to really be careful about how they dole out healthcare. But if they have the view that people, anybody over the age of 80, well, it probably won't work on them. Or, well, you know, they've lived long enough. I'm not going to send them for this surgery. I'm not going to send them for a specialist. That is just simply ageist. And later on, I'll talk about tips and hopefully I'll hear some of your stories about this. But my stepdad was in his 90s, still lived in his own home, very active, drove himself to Arizona and back every year. And he did that because he calculated it was cheaper than flying down. Sharp as a tack, volunteered everywhere, was finance, did the finances in the condo board, et cetera, et cetera, et cetera. I couldn't keep up to him in his 90s. He started to ask me to come in when he would see his physician because he started getting a backache. And the doctor would say, well, you know, you're old. You wouldn't benefit from this. And that was why he had me start coming with him. And this was a doctor in his 70s who was quite overweight and could barely stand and walk. And in fact, we found out later then he was going for both knees to be replaced. And then I started hearing from other people that in fact this doctor had said the same thing to them. Well, you're old. One was a 75-year-old woman with gray hair. And so the next time I was able to go in with him and he's, you know, because again, his back was bothering him. And, well, you know, you're old. You could just expect to have a sore back. And this was somebody who walked, drove, except I said, you know, that really kind of sounds ageist. And to be quite frank, he's in better shape than you are. You know, he's the right weight. He's very active. He can walk upstairs, and I don't think you can at this stage. And I really want you to send him to this specialist. And I'll tell you the rest of the story kind of as it went on. It took a little while, but he finally did get to see his specialist. But anyway, so again, if you use age as a criteria, it means that people don't get offered what they actually do need. And yeah, and we don't know if we're going to all live to be 100. So if you're 65, 70, 75, or what have you, and somebody is saying, well, you know, you're old, you know, and that's not an appropriate criteria. It's just, you know, will you benefit, you know, personally from that? You don't use age. The sad thing as well, though, it isn't just individual healthcare providers, but it's actually organizations like hospitals, healthcare systems, etc., that actually do use age as a care criterion. Some of you might remember when a man who was 80 in Alberta got a heart transplant, and it was a huge issue. And then they tried to justify it. Well, okay, he was a friend of the surgeon who did the surgery, but he also owned and managed a very big business in Alberta, and he was active and bright. He wasn't demented, etc. And it actually was a written policy at that point that people over the age of 80 could not be admitted to an ICU and would not be considered for a heart transplant or a liver transplant. Yeah, maybe they'd get a kidney transplant, but those were new at the time. The furor over, this 80-year-old getting a heart transplant made the hospital, the ethics committee, think about it, and they took it out of the written guidelines, but those guidelines are still there. If you look at who gets an organ transplant in Canada, partly because organs are so rare, not as many people should donate them as they do. You see, very rarely is it someone 80 and over that gets any kind of a transplant that's needed for quality of life or length of life. Very few of them also, too, will get aggressive cure-oriented cancer treatment. And there's a bit of evidence showing again that the younger you are, the better you're going to survive some of these, major aggressive cancer treatments. But using the age of 80 is not appropriate. Even ICU, CCU, whatever admissions, it's sort of an unwritten rule again that you really do look seriously at the age of the person and use that as well, they're over 80, they probably won't survive, so we won't do it. There's other clear evidence of ageism in healthcare. When you think about nursing home residents, almost none of them, when they became ill with COVID, were sent to hospital. And almost none of those ended up in intensive care unit because they're seen as being, let nature take its course. They're at the end of the life. We'll just let them go. Now, that was where my stepdad was. Sharp as a tack, but because he didn't get timely care for his back, he ended up getting crushed vertebrae, which pinched his nerves. And he lost the ability to feed himself and to walk. Like he had such multiple, compressing vertebrae. And so there he is, and in as sharp as a tack, angry as can be, having to go into a nursing home for 27 care. He was very afraid that he would never go to hospital if he had COVID. And I had that same fear. Now, thankfully, he didn't get COVID. But for his last 2 years of life, he had no visitors on site because they shut down the doors. And that was despite nursing home residents having the first vaccines that came around and the booster a month later. So their chances of getting COVID were much lower than the general population. But again, age was used as this idea of you're frail elderly, we have to protect you. They had no right to say, can we please have visitors? We're so lonely now. And it was really sad. I feel really sad for my stepdad. Now, and again, it's not just individual doctors and nurses and whatever, but, and organizations, but also people themselves and their families will use old age to believe that they just won't benefit from healthcare. It's useless. Why go for that colonoscopy or, why go for that surgery, breast cancer surgery or whatever? You're going to die in a year anyway, or, what have you. And, and of course, you'll probably get confused and demented and you even forget about it. So, so personally, you kind of think, well, I've lived long enough. I won't try and get any kind of health care for this. Or you kind of think, well, they probably won't give me anything and I shouldn't even ask for it. So those are some really common things. Anyway, come on, there we go. And, the reality though, is that 80% of people who are admitted to Alberta hospitals each year are under the age of 65. That's research I've done and others have done. When you look at who goes into an emergency department in Alberta, 95% of the people who are in emergency rooms each year are under the age of 65. And very few people end up in a nursing home. So why don't we get proper care for our older people, particularly when it's early and it can really make a difference? And remember as well, too, that when you go into a nursing home, you're paying out of pocket for the privilege of being in that nursing home. And it's $58 to $71 a day now, out of pocket charge. So anyway, just something to consider. In terms of inappropriate care, so you may not even get care, but if you do get care, the problem is that when you're 85 and you maybe weigh half what you did when you were, a 25-year-old on the football team, or the soccer team, most drugs are only tested on middle-aged adults. And really the effects on people at a much older age, a smaller body, sometimes with a little bit of kidney, smaller, fewer kidney cells, fewer liver cells to detoxify those drugs. Some drugs have a huge, much bigger effect on older people because, again, they've only been tested on middle-aged adults. There's very few studies focus on what will help older people recover faster or more fully. Few studies focus on what older people can do or should do to stay well. And the vast amount of dollars are spent on ill people, ill and injured people. So there's very little money left over for home care funding. So, and that's one of the big reasons why older people get trapped into a hospital, because there's no home care funding to get them out early. If you live alone and there's nobody at home to look after you, you're going to need a home care worker to pop in once a day or twice a day. And hospitals are not designed for long stay patients. And of course, we spend very little money on help people stay well into old age and throughout old age. So if you look in Alberta in particular, we spend $5 billion on our physicians. We spend $4 billion on our hospitals, a bunch of other things. And if you look at home care funding, we spend $660 million, very, very small proportion. And then you can, kind of look and see, again, public health is just, is about the same amount. So what we do to keep people well and to help older people stay out of hospital is very minimal. We spend money on sick people. We let people get sick and then they're looked after in the hospital. And one of the big issues is fee-for-service payments for those physicians. We've got just under 10,000 physicians in Alberta. And when you think they're paid fee-for-service, so they're not paid a salary and, know that they're putting into a pension plan and whatever. So they try and get as many customers through the door as they can. And so the quicker and faster, they can get patients through the door and out, the more they can bill. The problem is, particularly when you're older, those are very fast and incomplete assessments because they tend to focus on the one issue, not what caused the person to have that issue, but just the one health issue. There's a real tendency to send that patient off to get a test, which means then they have to come back to get the results. The doctor gets paid twice and we pay for the test, even if it wasn't necessary. And there's a tendency to prescribe medications because it's such a quick fix. Here you go, take a pill and away you go. And a lot of people expect to get a prescription as well too. So big issue with fee-for-service. But let's spend our last time on combating healthcare aging. What do we do about this? Well, first of all, test yourself. And tip number one, what do you do about a physician, is take in a test and say, hey, doc, I tested myself whether I'm, have ageist views or not. Here, I'm just going to leave this with you. Now, there's all kinds of ageism tests. The World Health Organization is one, and there was a review. And they thought this was the best one. And it's called Expectations Regarding Aging. And question number one, when people get older, they need to lower their expectations of how healthy they will be. So anyway, you can go through 12 questions and test your own, that, but certainly, take that into your physician and just say, hey, just, we don't need to talk about this or not, but hey, test yourself out. I'll talk about it the next time I see you or whatever. And again, you can get this PowerPoint if you want later. I really like this test though, and it's 20 questions. And question number one, I was told a joke that pokes fun at old people, but then it also gets into number 12, a doctor and nurse assumed my ailments were caused by my age. I was denied medical treatment because of my age, and a few other things like that. This actually was tested on Canadians to see how commonly this happens. And the four most common things that people experience was, I was told a joke that pokes fun at old people. I was sent a birthday card that pokes fun at old people. I was ignored or not taken seriously because of my age. And I was treated with less dignity and respect because of my age. That was a few years ago that this was done. I think it would be done now. They'd show more of the healthcare issues, that I didn't get the healthcare that I needed. Now, so number one, test yourself. Do you have, ageist views yourself, and ask people around you, check yourself out. So notice it, start looking for it, and think about yourself. Are you happy with your aging self? If not, what can you do about it? If you feel like you're, socially isolated, as many of us are because of the pandemic, well, this is a good time now to get out there and join some groups and meet some people and what have you. But also notice the people around you. Are they ageist? And draw attention to it. After this physician that was looking after my stepdad kept saying, well, you're old. And that's how he would say, well, you're old. What do you expect and what have you? I said, actually to me, you kind of look old. And I said, I laughed, I was bloody serious, I'll tell you though. And anyway, eventually I complained to the office manager. I got a different physician for him. And in the meantime, I reported him in writing to the College of Physicians and Surgeons because he hurt my stepdad by not getting the attention that he needed when he could have had his back fixed. And he lived the last 2.5 years in a nursing home, and he didn't have, and it was terrible for him. It was really sad. So draw attention to it. And think about, again, if you get a card like this, from a grandchild or friend or, etc., just kind of say, hey, let's go out for a jog and let's just see who's going to win here. Or just draw attention to it. And the internet is so fascinating. Well, that's the microwave. Again, just kind of say, hey, that could be kind of ageist, kind of maybe a little sexist too, but or with cards kind of like this, again, you can kind of say, hey, they should really throw these things out, because it's not true. I hope you don't think that I'm like that, or that I'm going to get that way. Okay, so another thing as well too that's critical is form or join lobby groups to combat ageism in healthcare. In employment, in pensions, in weak legislation to combat elder abuse, and anywhere else that you think that that older people are being discriminated, including MAID, believe it or not. My stepdad got to the point where he said, I'm alert, I'm oriented, and I'm hating it here. And he says, I know my health won't get any better. Can you see if I'd be eligible for MAID? And he's not, because he just is old. He does not have a right for that. So there's lots of wonderful groups that are well-established lobby groups, and age should not be the main criteria or the determining criteria for healthcare or for anything else. So remember, again, we have the issue that ageism in healthcare could get worse. because there's this tremendous fear about a bigger proportion of the population being older and more people being older, particularly very old. And there's all kinds of fears. But the reality is, bring out some statistics if you can. Talk about 77% of surveyed grandparents in Canada rate their health as good, very good, or excellent. And that's better than it was 10 years before. Start, if you can, have some statistics at hand. There's lots of them out there. Even in terms of dementia, everybody will become demented the older you get. No way. Totally inaccurate. Only 1.5% of Canadians live with dementia today. Certainly it's, if you're 95 and you've been exposed to, all kinds of chemicals, as so many people did over their lives, chemicals that are now banned, much heavy smoking rates compared to there are now. Of course, we have more dementia. We should see less dementia over time. Depression, oh, well, old people are depressed. Are you kidding? The prime age for depression is age 15 to 44. Those are the most depressed people in Canada, disability, et cetera, et cetera. I mean, there's all kinds of facts and figures that you can use. Is there hope? Definitely. We're seeing a lot more hope, lots of younger people and movements and research. We got our charter rights and freedoms. We're seeing some good efforts, but again, we need to work against this, and including Ontario having an age discrimination against healthcare, fact sheet out there. So in closing, we are increasingly experiencing population aging. And Canada is being impacted by population aging, but it's a time really to notice and combat healthcare ageism and ageism elsewhere. So I will stop there because I'm looking forward to questions and sorry, lots of information. I could have gone on for a half a day on this. So I will stop my share and bring the organizers back. I hope this was kind of helpful to you there. Okay, that should get me out of there. Carolyn, is this okay, or Kathy? And I stopped the share, so.
Just not sure if we've got some questions there, Caroline. Do we have any questions from the participants in this session?
Yeah, I think if there are any questions, if you could raise your hand at the bottom of the toolbar, just click on reactions. If you click on that, and then it says raise hand, and I will look for the icon. So I don't see anything offhand. I do have a question in the chat box, and from Diane. Will you be sharing Dr. Wilson's slide deck? There was some great info there. Yeah, I don't have a problem with doing that, Diane. You can actually access the PowerPoint on our YouTube channel, and we'll be posting it shortly. And what I'll do is I will put the link to our YouTube channel in the chat for you to access. But yeah, don't hesitate to contact us also at agefriendlyedmonton.ca if you have any. If you want the PowerPoint, I can send it to you directly that way as well.
And you can also email me directly if you like. It's handy, and I'll hand it on to you and can respond to any kind of questions if it comes up. Maybe while I wait for more chat questions to come out or whatever. I was just again trying to finish so there'd be time at the end in case anyone had questions, but one of the big fears now is that family caregivers looking after an older person are burning out, that it's just such a huge burden, thankless job, etc. So thanks to Alberta Health, Alberta government, I've got a really nice large research grant to study family caregivers. The wonderful work that they do to help older family members stay out of a nursing home and stay well and stay out of hospital. And so we're looking for volunteers for that. If any of you, help an older family member who's not living in a nursing home, I'd love to hear from you as well too. But, that's another myth that, if you're looking after an older family member, it's terrible. It's just awful, totally time consuming, and you'll burn out and become ill and whatever. There's a lot of wonderful things that come about, and you have the time together that you spend. Those are some of the most meaningful hours and days that you will spend in your life. And I wish now, with my dad and that, who's been gone for 10 years, I wish we had more time together, even if it was at the bedside with me just holding his hand or, helping him, dress or eat or what have you. Really that's time that is very precious. So anyway, I'm still looking for questions.
Yeah, there are a couple of questions. I believe Carmen has her hand up as well. So Carmen, go ahead, and then we'll take Catherine after.
Hi, Dr. Wilson.
Hi.
Thanks for the information. It was great. I just wanted to know, so I'm 63, so I'm young still. I consider myself young, but I looked after my mom. She was in care, but I was her main advocate and caregiver. And I just found that there was lots of, I found staff being overworked, and that she wasn't, her needs weren't, I don't know, taken into consideration as much as I thought they should be. And I just wondered what your thoughts might be. Do you think things will change? I'm thinking of myself as I age. I may have to go into care, and I don't know. I don't want to do that.
Yeah.
I don't know.
Thanks. Thank you so much for raising that, because I've managed hospitals and I've managed nursing homes. And the big issue is, if you're in a hospital, acute care hospital in Alberta, or pretty well in Canada, you get 4 hours of nursing care in a day. That's if you're in a hospital. If you're in a nursing home, the staffing level is at 2 hours a day. And yet when you think about it, people in hospital, many of them are up walking around. If you're in a nursing home, typically you can't walk. You have to be lifted into the chair and on the toilet. You maybe have to be fed and everything else. So one of the big issues during the pandemic was family members couldn't come in to help feed and dress and clean teeth, brush hair, et cetera, because they're, the cheap helper in nursing homes. Now, there's a number of groups across Canada that are pressuring every government to double up the staffing in nursing homes so that it's similar to a hospital. Now, the problem with that is it means, either governments have to pay nursing homes more, or people have to pay more to be in there, or it's a combination of both. And that's why I put that, how much it's about $60, $65 to be in a nursing home in Alberta now. What we see more though in nursing homes are assisted living facilities and lodges and other like seniors complexes. And the big issue with those is most of them are $5,000, $6,000 a month to live in there. And you would still need to get a home care nurse to come in and help you if you didn't have a family member and were forgetting to take your meds or what have you. So one of the big things then is to be good to your kids, your friends. That's tip number 4, I guess. So, hey, I'm going to help you now because boy, if I need help later on down the road. But, again, most of us will stay in our home until, we may downsize to an apartment. I don't want to be in a big 4-bedroom house that I raise the kids in. So at some point I'm going to downsize. The reality is most of us will not go into a nursing home. And only maybe, about 10%, or into a nursing home 6% into assisted living, 90% of us will still be in our own place. And we might move in with the kids, but whatever, but that's it. So thanks for raising that. Yeah, great, good to talk about that. I think there was another hand too.
Yes, we can take one more question. I know it's 1 o'clock, and so I believe Catherine Jensen had her hand up. So go ahead, Catherine.
Yeah, I was wondering, is there a difference being made? Are people coming together and raising this issue with our governments in that? Because me, myself, I see the ageism. My husband had a bone marrow transplant in 2016, when he is 68. The cutoff age is 65. We were told that to our faces. But because my husband had huge family support, plus he had doctors who really pushed for him to have it, he did have it. And even with my parents, we pushed, like a whole family came together and just pushed the doctors. We had to work so hard to get them to see beyond their ages.
Yeah.
So is there a difference being made? I have a 96-year-old dad who's smart as, he's just so with it. But he's gone to a doctor. He's complaining about it. The doctor says I'm old. I mean, it's terrible.
Yeah. I think we're slowly getting there, particularly because of people like you. That you educate one doctor, one hospital, whatever, and it's kind of sometimes a one of, but we're now even having courses that nurses take when they come in and do their nursing 4-year nursing education. And I'm giving talks to the medical students once a year and things like that. So we are getting to there. In some ways, it's kind of inevitable, though. I mean, once we've got, 20 to 25% of Canadians are over age 65, we're going to get a lot more people pushing back and saying, look, hey, I'm working full time. Why can't I get a bone marrow transplant? Why can't I get my knees fixed now so I can keep working? So, it's kind of a gradual thing. And that's why, at the end there, I should have stopped and paused a bit more, because it is getting better. There's a lot more awareness of ageism, but it's still an uphill battle. It really is. And again, it helps to have families that really, argue for you, that help you, and so again, the thing is not to give up. Like you. Good for you.
Well, thank you. Thank you so much. Thank you for the questions, and a special thank you to you, Dr. Donna Wilson, for your fabulous presentation. I see in the chat box a number of people have thanked you for this wonderful presentation. So much information, so much myth busting, and also a challenge for us to test ourselves and find out what is our own perceptions about aging, and maybe we can all do our own part in the change that needs to happen so that people aren't discriminated against because of their age. And so if anybody has any other questions, sometimes people need to digest some of the information. Please do not hesitate to send your questions either directly to Dr. Wilson, or you can also send them to Age Friendly Edmonton. The information, the email address is there. Also, we will be sending a short survey about the event. So please take the moment that it takes to say what you were thinking and how it affected you. And it really helps us as organizers, but also it just helps to know what are the next steps for all of us. So thank you very much for coming today. And just wanted to let you know that Seniors Week is coming up at the beginning of June, kicking off at City Hall Monday, June 6th at 11 a.m. Everyone is welcome. It's a free event. and we have a lovely program to celebrate seniors in our community. So thanks again, everyone. Have a great day and hope to see you at the next Lunch and Learn.